Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral, fully occluding earwax, and this earwax impaction extended all the way from the entrance of the patient's ears all the way towards their eardrum, so the medial aspect. And it was this there right ear that was causing the patient their main symptoms. A few days ago, they returned on a flight back from holiday, and they experienced some pain in the ear, and then the following day they really struggled to hear, and so they used some drops which then exacerbated their symptoms. They were a bit nasally, so upon attending initially before examining the ears, I wondered whether the patient may have eustachian tube dysfunction, which is when the tube that connects the middle ear to the back of the nose is known as the pressure equalizer in the ear, and it's also a drain pipe. Any fluid that accumulates behind the eardrum, it allows it to drain out into the back of the nose, the nasopharynx. Whether the eustachian tube was blocked, because quite commonly, especially this time of year when people are going on their summer holidays, when you descend more often than not on an aeroplane, because of the air pressure in the cabin is greater than the air pressure behind the eardrums. When you're descending, the air pressure is going into your ear. It can push the eardrum inwards, especially if the descent is very quick. If it's a slow descent, then your eustachian tube may be able to handle it and able to equalize it without you even realizing and noticing the pressure change in your ear. So as you can see, that wax plug came out nicely in a large plug. They have got a bendy ear canal now. Ironically, it was their left ear, which they didn't really have much symptoms in, which is much more tricky. So do stay tuned for that. And there was an anatomical reason as to why their left ear was more tricky, and you'll see it on the video in a moment. So just going back to the eustachian tube dysfunction, it's normally upon the descent on the aircraft that most people notice it. And if you do suffer from that, there's several things that you can do. A simple trick is to suck and chew on a hard-boiled sweet upon descent on the plane. You've got the Valsalva whereby you pinch your nose, close your mouth, and you blow into your nose. So you trap all that air inside your nose. And what happens is the air pressure builds up in your nose. It causes the eustachian tube to open. So the eustachian tube opens up where it connects to the back of the nose. So that resting state is closed. So you're forcing it open, and you're forcing air up the eustachian tube into the middle ear space to pop the eardrum back out. Now, people ask, is there a chance of perforating your eardrum doing that? Yes, there is a chance, but it's a very minimal chance. The Valsalva technique is a diagnostic test that ENT and audiologists sometimes use to assess eustachian tube dysfunction. Yes, if you overpressurize it, there is a risk. I can't tell you otherwise, but as long as you're doing it sensibly, it should be okay. Alternatively, you can use an otovent nasal balloon, and that's whereby you inflate a balloon using your nose. So the balloon, and it comes with a nasal capsule. You attach the balloon on one end, the other end you position it at the entrance of the nostril. You pinch the other nostril shut, the contralateral one, you close the mouth, blow into the balloon using your nose, and as the balloon inflates, the size of an orange, if you can swallow it, all the better, because again, that helps to open the eustachian tube. And when you're blowing into the balloon, you're also building up air pressure in the back of your nose. Now, the reason why the otovent nasal balloon, I would say, is the safer option compared to the Valsalva, if you've got concerns, is because it's very difficult to over pressurize the back of the nose by using the otovent nasal balloon, because the balloon will just extend or just get bigger. So the balloon, in a way, caps how much pressure buildup you can accumulate at the back of the nose in order to cause the muscles that cause the eustachian tube to open to contract. Then I think another popular device, I think more so in the in America, it's not, in the UK we call it the ear popper, but I think there's a similar device. I'm not sure exactly what it's called, but there are things on the market. You can also get pressurized earplugs, especially for flying. So it helps to reduce the speed, really, and the severity of the pressure change as you're descending on a flight. So there are various options, so do take a look. So let's just talk about this patient's left ear. Now, you can see it's quite a struggle at the moment, and the reason for that is where we are here at the moment. This section of the ear canal, probably the midsection, is extremely narrow, and you'll get a better idea of how narrow it is once I remove this plug, because then once we get through this narrowing, the ear canal significantly widens. And because the patient wasn't really noticing this in this ear, it's just been gathering and gathering and gathering beyond this midsection, and it is a real tease to remove. And I tried forceps a couple of times, but there's just not enough space for the forceps to, when you open it, to go either side of the plug. And as a result, what the forceps was inadvertently doing is pushing this further in. So you can see there's limited space vertically, from left to right. So the width is very, 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 very narrow. So you can't, I did try, I think several times, you can see again, I've just changed the angle, but it only opens so much because of the ear canal, and then it's just not wide enough. And so I stretch it as much as I can. But if I go any further, because ideally I want to go in further to get a good grip, but if I go any further with the forceps, it's just, you can see momentarily it's pushing the plug further in, and then I'm grabbing it, I'm trying to bring it back out. So wasn't really suitable for forceps extraction. So in a moment I'm gonna, I'm not sure, still another couple of minutes, a few minutes left of the video, so I'm still gonna attempt to remove the forceps. I'm gonna use the suction again. I used the ear hook a couple of times. Eventually I managed to manufacture an opening at the roof of the ear canal, whereby I inserted the hook, and I'll come back to that because even that was quite an interesting phase of the wax removal. I'm just using the microsuction probe again because in the last attempt the wax plug went further in, so bringing it back forwards again. That's the thing with these type of plugs. You've got to be careful that when you're using mechanical instruments, you're not pushing it further into the ear. With suction, obviously, it's very difficult to do that unless the suction probe is blocked and you're not aware that it's blocked, because otherwise the suction is bringing stuff out. And that's why suction is used quite a lot by a lot of specialists, including myself. Now, I would say that I use 60% suction, 40% mechanical instrument. Probably, actually, I would say it's even Stevens now. But I would use a combination if required. I wouldn't just feel, oh, I'm just going to use suction in this ear. Whatever's necessary for the job. And quite often I've got ear hook on the table, Jobson horn, I've got suction probe, forceps, a fine end. So I've got the whole repertoire of ENT utensils, instrumentations. Just something interesting. I'm going to be launching my own range of instrumentation alongside the wax scope. The wax scope is, we've had some delays if you've been watching, if you've been following it. Beyond my control, I won't go into it. We just got let down by a particular company who was making a particular part. Don't really want to say more than that because it is what it is. But fortunately, I've just taken ownership of the manufacturing completely myself now, and I'm manufacturing it myself, and all is going to plan, and we should have the parts that in question, some samples ready for next week or the week after, I think. So fingers crossed. But at the same time, I'm busy doing a few things. One of the things I don't want to mention at the moment because until I apply for patent, I'd rather keep that close to my chest, so to speak. But I am, things I can disclose, I am improving on some of the instrumentations. Some of these instruments, I think there's improvements to be made. Again, I don't want to say too much to give the game away, but I'm really excited. And just today, I received some CAD scans back for the instruments. Just needs a bit of refinement, and hopefully next week we'll have the final CAD and I can get some prototypes made, and then if all going well, we can start the process of mass manufacturing them. So that's exciting. But the reason why I'm bringing that up is one of the instruments that I'm making, it would work really, really well in this particular case. So it's going to be exciting. So you can see I managed to extract that behind. Now, this is the bit that I thought it was really interesting. I was trying to bring this through this midsection, and I had to apply so much force, and this wax plug was so impacted. You can see even then it's just stuck. And that's because this wax plug, it's rock hard, and it's about 4 times, I would say, larger than that midsection. The ear hook was bending. It is almost like a pole vault athlete who was trying to go over the bar with a pole vault, and that pole vault flexes backwards and it springs back forwards, and that's how it felt. It was incredible. And these are carbon fiber instruments, so very, very strong. So you can see now, I'm just hovering over this midsection. I want you to have a good look, see how narrow it is. we go through it and then it widens. I'd probably say it's 3, maybe 4 times bigger. And that's why it was a bit of a squeeze, but we managed to get that out. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.